Trauma, whether physical or psychological, can affect the emotional and sexual relationships of wounded warriors and their partners. Understanding the sexual changes and challenges your wounded warrior may experience can reduce your anxiety and feelings of inadequacy and hopelessness, allowing you to improve your sexual relationship. According to the National Spinal Cord Injury Association, sexual intimacy is one of the first areas of a relationship to suffer when a non-disabled spouse takes on a caregiving role. The demands that come with caregiving may make it difficult to balance your roles as caregiver and partner. Caregiving can be emotionally, intellectually, and physically challenging. It is normal for these challenges to affect the intimacy of your relationship. You may lack interest in sex because of fatigue or stress, as well as the emotional memories of what the sexual relationship was before your partner was injured. According to the Journal of Rehabilitation Counseling, communication is a necessary component in any mutually satisfying sexual relationship, especially when one partner has a disability. Effective communication helps you learn what is and is not comfortable for your wounded warrior and what capabilities and limitations he or she may have, as well as any subsequent problems and tensions that need to be addressed. Don't hesitate to ask questions for fear of offending your wounded warrior. Talking about your concerns offers support and gives both of you an opportunity to reassure each other. When a physical injury affects self-image and the ability to be sexually intimate, your partner may question his or her identity as a man or woman. Communication is crucial to overcoming these negative self-images. Communication with professionals is important too. Talk to your wounded warrior's doctors, nurse case managers, social workers, and counselors about sexual or couples therapy, sexual rehabilitation, and counseling to learn alternative methods of sexual intimacy and to enhance your relationship. Redefining your understanding of sexuality and sexual expression can instill hope for reinventing your sexual relationship. Talk to a sex counselor about methods you and your warrior can use to give and receive pleasure. Depending on the combat injury, sexual behavior, capabilities, and desire differ. Certain injuries may demand changes in sexual habits that require the wounded warrior and his or her partner to be creative. If your wounded warrior has lost a limb or limbs, you may need to learn to accommodate these injuries. Sometimes, post-traumatic stress disorder can cause emotional distress that may hinder sexual activity or lessen the ability to sustain arousal. After a spinal cord injury, sexual satisfaction usually decreases and bodily functions have to be relearned. In some instances, sexual responses may diminish, disappear altogether, or become cross-wired with other pelvic responses, such as perspiration, or bladder and bowel function. Certain areas of the brain are important for regulating and controlling particular aspects of sexuality. Wounded warriors with traumatic brain injury may seem preoccupied with sex, talk about it at inappropriate times, or demonstrate inappropriate sexual behavior. Although the wounded warrior may appear to have a greater sex drive, the reality may be that the part of the brain that helps hold back these impulses or urges is damaged. Medications to alleviate pain associated with physical or psychological injuries can affect sexual desire and performance. According to the American Journal of Nursing, patients who suffer from post-traumatic stress disorder or other injuries requiring the use of antidepressant medications, particularly selective serotonin reuptake inhibitors, may experience sexual dysfunction, specifically with arousal and orgasm. Painkillers, or psychoactive drugs that stimulate the mind and alter one's behavior, mood, and consciousness, can cause fatigue and have other adverse effects. Excessive alcohol use or any other form of self-medications for wounded or traumatized warriors can significantly affect arousal, desire, erection, and orgasm. In many cases, medical professionals can assess sexual functioning in post-combat military personnel in the acute or chronic stages of rehabilitation and recovery. During this time, you may wish to talk to your wounded warrior's doctors and nurse case managers about the adverse effects that medications may have on his or her sexual function. While this new caregiving role can place a heavy burden on your relationship with your wounded warrior, know that you are not alone. There is hope. Continue to seek advice about ways to enhance intimacy and keep your relationship strong.